All right, I'm gonna go over wear and care with you. So you should have your helmet hair day one handout here. And I'm just gonna run through that with you. Make sure that everything's explained thoroughly, and then if you have any questions, we'll talk about that. So first thing is putting the helmet on. So as I kind of showed you when we were putting it on your baby, what we're gonna do is we're gonna open up that lateral seam. We're gonna grab on the edges of the helmet. We're not putting our hands on the inside. If they're on the inside, we have to get them out and it can sort of like slap shut. So we're gonna put our fingers on the edges. Make sure you're never using the strap to pull open because you will or could pop those rivets. So we're grabbing on the plastic, we're pulling nice and wide. You're not gonna break the helmet. Now this helmet is a used helmet, so it's got a little bit more give to it. Your baby's helmet's gonna, that plastic will kind of move more as you're using it, as you're wearing it, but pull it kind of as wide as you can. Like I said, you're not gonna break it. We're gonna line up the ear that's closest to us, and then we're gonna take the helmet and we're gonna put it on in sort of a, not straight from the top, not straight from the side, but we're gonna sort of open it up using that ear as our guideline, rock it on. So we want the helmet, obviously this does not fit our little baby here, but we want the helmet to fit so that that dip is coming right down in the center. That's gonna help you to kind of know if it's rotating or if it's centered, and it helps me as well. And I also, I just think it gives it a little softer edge, lets us come a little bit lower. Our goal for that trim line is sitting right above the brows, can kind of dip down in between and then right above the brow again. So every once in a while we'll have one that doesn't have a dip, but most of our helmets do. We're gonna wanna come back, look from the front, check the ears, make sure the ears are sitting properly, make sure it's not tipped forward or backward. And to do any movement on the helmet, what I do here is I take my middle finger, index finger, I open it about a 1/2 inch, then you're usually able to kind of wiggle the helmet wherever you need to. If it's on and you're just trying to move it, your baby's not gonna like that. It's gonna have some friction. So you always wanna open it up a little bit and then move it. And then you're gonna come back, check all those spots. So once you've got the helmet on, you come back, make sure everything's lined up. You always wanna check the seam, and you're gonna wanna make sure that the seam is touching. If you have to give it, so you're gonna feed it through. If you have to give it just kind of a gentle tug to get there, that's fine, but you should never be like cinching the helmet down onto your baby's head. If you feel like that gap does not close, that means that your baby grew somewhere inside of the helmet outside of the shape that it was made to. And so we're gonna have to make some adjustments to get it back to fitting. Or it's sitting on their head maybe like too far down, too far back. So maybe try again, but if you try 2 or 3 times and you just can't get that seam to close, there's been some sort of growth that's impeding that. So that's putting the helmet on. Step-by-step instructions if you need some of those reminders. The next big thing to talk about is break-in schedule. So our goal is to wear the helmet 23 hours a day, but we're gonna work our way there over about a 5-day period. So day one, we're gonna wear it for an hour length of time. So hour length, at least a 30-minute break. Repeat that about 2 to 3 times per day. So really your total wear time on that first day is just about 2 to 3 hours. I don't want you wearing it for an hour, taking just like a 5-minute break, putting it right back on. I want you to take a good 30 minutes between those. And likely it's gonna be more than that because you're probably, we're not wearing it for naps or nighttime. So you're probably gonna have like wear it for an hour, you know, it's nap time or feeding time, take some sort of a break, then go to put it back on. So no naps, no nighttime for day one. Day two, we're wearing it for a 2-hour stretch of time. Again, 30-minute breaks between, no naps, no nighttime. Total wear time of about 4 to 6 hours. Day three, we're wearing it for 2 to 4 hours, 30-minute breaks. Let's go ahead and try naps on day 3. Usually that goes pretty well. Of course, you can, you know, these are guidelines. If you're wearing it for like 45 minutes, your baby's about to fall asleep in those first few days, go ahead and take it off. These are guidelines, but this is our, you know, to try and get to that full wear time. Day 4, we're gonna go ahead and wear it for about 3 to 4 hours at a time. Again, about 30-minute breaks, and then try naps. And if that has gone well, go ahead and try nights. If you're still feeling like you're just unsure, baby's still getting used to it, or you're still getting used to it, that's fine. But by day 5, we should be up to that full-time wear, 23 hours, naps and nights. And if we're not, then we just have to have a conversation about why we're not there. Is it bothering your baby? Is your baby seem too hot? Is it bothering you? Or are you just feeling bad about it? You know, those are all real things, and we can have that conversation. But please always stay honest with me about your wear time, because that helps me to know why, you know, what's going on in the helmet and why. So every time you're taking the helmet off, you want to make sure that you're checking your baby's skin. So red marks are good, and we're going to have red marks, but I want those to diminish after about 30 to 60 minutes. So they should at least getting lighter. Even if you can still see a little bit of pinkness, it should be fading somewhat. Our little reminder here that helmets are a commitment. I'm big on full-time wear schedule. So just a reminder. So cleaning, another big question we usually have. So I recommend 2 different ways to clean the helmet. The first one, and now this is on the back side of our handout here. The first one is to do a deep scrub, and that's going to be every few days. You can do it every day, but you don't need to. Every couple of days, using whatever baby shampoo you already use, so that we're not introducing any new scents or any new dyes. Scents and dyes are typically the things that are going to cause skin irritation, especially if the helmet or the head is not rinsed really well. But go ahead and just start with whatever you've already used. Your baby's used to it. So wash the inside of the helmet. You can go ahead and scrub on all the foam areas. If there are pads added, they can get wet. Just make sure you're not like scrubbing at the edges, because the glue will release, you know, if you're scrubbing at it too hard. But go ahead and scrub. Now this helmet is a worn helmet. You can see there's a little bit of yellowing, some discoloration. A little bit of yellowing even after the helmet is clean is normal. But you shouldn't be able to like run your finger and get residue. Once you're done cleaning the helmet, it should be clean on the inside. The other way to clean the helmet, and this is, you can do this kind of every day, a couple times a day, is to just use rubbing alcohol in a little spray bottle. And here is your little spray bottle. Again, you're going to fill that up about 1/2 to 3/4 full of rubbing alcohol, and then the rest with water. Spray that in there, wipe it out. You're still going to want to let it air dry. And I recommend putting in about 1/2 or a little bit more than 1/2 of a rubbing alcohol, and it can be, 70 or 90%, just isopropyl alcohol, and then the rest with water to dilute it just a little bit. Spray that in there, wipe it out. You're gonna let it air dry, and then go ahead and you can put the helmet back on. So our next point is skincare. So it's important that we prevent skin breakdown. Prevent skin breakdown. Skin breakdown is considered sore, raw, blistered, or irritated skin. Redness is okay. We need to have redness in order to get correction. If you think of redness like when you would take off a tight watch or a tight headband and there's redness there from that contact, that's the kind of redness that we're looking for. Oftentimes we do tend to see a little bit darker or more kind of rashy skin on the cheeks and the back of the neck. That skin's just a little bit more sensitive than our scalp skin. So that sometimes we can use a little bit of Aquaphor. Again, I'll give you little samples of Aquaphor inside your goodie bag. So redness is good, but we want it to fade over that 30 to 60 minutes. If it's not, go ahead and put a little bit of Aquaphor on it. And then also, if you feel like a red spot kind of popped out of nowhere, like you're doing fine, you've been wearing it, it popped out of nowhere, go ahead and track back a little bit. Was the helmet on a little rotated? Was your baby sleeping on that side? Could something have gotten in there, even like dog hair or, something kind of gotten in there and irritated? So kind of track back, because usually if it pops up out of nowhere, it's circumstantial and it's not necessarily something that needs to be adjusted within the helmet, but it's, something happened once. Next main point, so be sure to dress your baby in light clothing, especially for sleeping. When I have babies who tend to struggle in that first week of getting used to the helmet, it's usually because they're too hot. So you really want to find that like cotton sleeper fan combination that's going to work to allow them to be a little bit cooler. Excessive perspiration is normal. It will fade after about 2 to 3 weeks and the body kind of re-regulates. But they will be sweaty. We can always put holes in the helmet if that's something that you think, yep, let's definitely do that. Just go ahead and let me know. Sometimes we'll wait and see how they react to it. So because they're hot, sweaty, think of when you take off a winter hat and your head is itchy, your baby is going to be itchy, but they've got little razor blade fingernails and they'll scratch until they break open the skin. So try to beat them to it. When you take the helmet off, go ahead and just literally give them like a nice head rub, especially behind those ears and those spots where the helmet's fitting a little more snugly. If your baby has trouble with heat and sweating, if it seems like it's consistently an issue, what I recommend is diaper breaks. And why I call them diaper breaks is because kind of creating a pairing. So you know you're gonna change your baby's diaper every few hours. So if you just give them a little short 2 to 3 minute break every few hours, that can sometimes be really helpful just to let their head dry a little bit, get a little bit of air. And that's why they're called diaper breaks. Some babies do really well with the helmet. They don't like it on and off, so diaper breaks might not be the thing for you, but it is just an option. If your baby has a fever, they're sick, always take the helmet off. A fever is serving a purpose. We don't want to hold that heat in. So just take it off. Again, obviously, our next section here, I talk about, the commitment to the wear schedule. And the reason why this is so important is because we have hold spots. If we're not wearing the helmet, if you're like, well, they're not wearing, they're not sleeping on their head, the back of their head at night, they're on their belly now or whatever. Or they're only on their head at the back, only on the back of their head at nighttime. We don't need to wear it as much. Well, what happens is those hold spots turn into pressure spots because the head isn't going to grow just in the direction that we're guiding it. It's going to grow in all directions. And then when we go to put the helmet back on, those hold spots are now pressure spots, and we start having to chase these red marks, skin breakdown, and all that. And it kind of turns into this snowball effect. So on the flip side of that, also, I want you to wear it full time. Absolutely. But I don't want you wearing it like 24 hours straight. Like, oh, we wear it 2 days straight. We wear it 48 hours straight. I need your eyes on your baby's skin at least 2 times a day. So usually first thing in the morning is a good time to check because they've just worn it for quite a bit of time. But I want to make sure your eyes are on their skin. You're checking them at least 2 times a day. However, you kind of break that up. Even if you're doing kind of an hour break at night and you just do a 2 to 3 minute break right away in the morning, that's fine. But make sure you are checking their skin. Have fun. This is, no one wants their baby to have to wear a helmet, but I promise you it's not that bad. Babies can read our emotions. If we're really anxious, we feel like we're tense, we're anxious, they can feed on that energy and they're gonna have a similar reaction. So try to keep it positive. If you struggle with putting it on and you're starting to get really worked up, just take a break. Take a 5-minute break, come back in a few minutes, maybe you try again. But try to just keep that, calm. You're putting it on like, yay, we have your helmet's on, yay. Most babies do not mind their helmet. They do really well with it. They actually get to a point where it can become like a comfort thing and they want their helmet on, or when it's off, they know it's theirs and they're holding it. So try to have fun. Try to remember that this is a really short amount of time relative to the results that you're getting that are lasting a lifetime. Try and be positive. Our goals, diagonal asymmetry, we always want to get that under 5. That's those 2 measurements on a diagonal, comparing the difference between those 2, and our cephalic index between 80 and 90. If you have any questions or concerns, feel free to email me. So my email is just Cassie@babybearcranialclinic.com. That's going to come right to my phone. So I'm going to get it really quickly. And I will get you a response really quickly. I always say it's not going to be like this nice professionally written, like, thank you so much for reaching out, blah, blah. I'm going to say, that looks good, keep wearing it. Or, because I always recommend send a picture. If it's a spot that you're concerned about, send me a picture so I can get an idea. Pictures don't always do red spots and things like that justice, but it helps to give me a good idea. Or maybe it's like, no, that's too red, keep it off and let's get you in as soon as possible. But feel free to use email as kind of the main way to get a hold of me. You'll get surveys kind of throughout your treatment. It's an automated thing, so it sends it as long as the appointments weren't within. We do strive to have a really strong customer service base. We want you to be happy. We want to make this experience positive. So we always ask that if we're able to achieve that or not, let us know. You'll get like the Cario reviews. Google reviews are also awesome because that's a whole nother world of that. So hopefully you don't have any questions. If you do, I should be back in the office soon here and we'll go over those questions.